I'm Dr. Chuck Pearce. I'm an orthopedic surgeon. I specialize in arthroscopic problems of the shoulder and knee at UAMS. One of the reasons I enjoy taking care of patients with shoulder problems with arthroscope is not only is it more cosmetic because we make very small incisions, of course, we can see inside of the joint. A lot of times if you have what we call an open procedure, which is a regular incision, if you have that for rotator cuff tear, the rotator cuff can be repaired and can do quite well. Unfortunately, when you do that, you can't see inside the ball and socket joint. And with arthroscopy, it's a very simple process, and it's something that's done every single time I do an arthroscopic procedure on the shoulder. There's some studies out that I actually was lucky enough to be a part of, and we looked at that particular problem, and it looked like about 20% or 1 in 5 patients had undiagnosed problems in the shoulder joint that we could take care of at the time of arthroscopy. If you have open procedure that's never seen, and if the patient still has pain or problems down the road, you'll wonder what's going on, and it could have been something inside the joint. Arthroscopic doesn't necessarily mean you can make the tendon heal any faster, but the pain is less. You don't have to cut any normal tendons or muscles to get inside of the joint like you do in open procedures. And the recovery, I think, is a lot easier process. Generally with arthroscopic procedures of the shoulder, unlike the knee, we can't use a tourniquet on the shoulder, so we have to be very careful about trying to control blood loss. But because we use the arthroscope, which actually involves putting sterile saline water, it's basically body water inside of the joint. It expands the joint and makes it where I can move around, and also controls the bleeding. So there's normally very little bleeding with arthroscopic, whereas with regular open procedures there can be a lot more blood loss.